So good morning, everyone, and welcome to the Dalles Chamber Community Affairs. Today, our guest is Representative Jeff Helfrich. He is here to give us a few updates as they're navigating Salem at the moment during the legislation season. It is the long one, so they have to do the endurance and get through everything. So I know we've had some deadlines come, and if some of those measures and issues didn't make it to a committee or on the floor, they're dead. Some of those may have been good to die, some of those may not. So we'll get some updates, but I know that also Representative Helfrich had a couple things regarding some of the housing and transportation, which greatly affects every community in this state. So we will begin and go around the room. And so Scott McKay.
Good morning, Jeff. Good morning, everyone. Scott McKay. I'm a community liaison for Circles of Care, which connects older adults who need some kind of periodic support with volunteers. Also, we're a partner in the dementia-friendly Wasco County Partnership, and we're looking at providing education regarding dementia, support for caregivers, and respite adult care for those living with dementia. So, thank you.
Thank you. Dan Spots.
Thank you, Lisa. Dan Spots. Good morning, everyone. Economic Development Officer with City of the Dalles for at least a few more days. I hope to be introducing my successor before too long, maybe another couple of weeks. On the child care side, you'll see a story in the paper this week about loss of the federal grant for the Early Learning Center. Very regrettable, but also it's a little bit up in the air still. There was a list that came out from EPA, 400 grants across the United States, about 20 in Oregon, that were being terminated, but we are getting mixed messages on whether all of those are actually taking place. There's a whole lot of confusion out there. We've not received a formal notice. And so we have Senate staff, congressional staff investigating this, trying to figure out where we are on this thing. 20 million, almost a $20 million grant. It spells the difference between turning the former Chenoweth Middle School into an early learning center or having to put that on hold. So stay tuned.
Thank you, Dan. Phil Brady.
Good morning, Phil Brady, Wasco County Commissioner, and I'll be in Salem Monday and Thursday of next week. Hope to see you there, Representative.
Awesome. Thank you. Brian Tuck.
Brian Tuck, retired. And Dan, looking forward to you joining the group of retirees here, buddy. It's a good place.
Thank you, Brian.
And Troy Rayburn.
Good morning, everyone. My name is Troy Rayburn. I'm a native of the Dalles. I was invited just to listen in and learn, and thank you for the invitation.
Thank you for being here. Darcy Long. Oops. Her screen may have froze. Darcy, if you can hear me, we'll come back to you in just a sec. Dave Peters.
Good morning, everybody. Dave Peters, Columbia Cascade Housing. Can you guys hear me? I've had a news.
Yes.
Okay. Yeah, so I'm with Columbia Cascade Housing and Mid-Columbia Housing Authority. We just signed all the major papers yesterday for the Rand Road Mariposa Village project in Hood River. That was yesterday. That's great. 130 apartments in Hood River. I work on the Housing Resource Center side, so we have some veteran down payment money left. We have up to $90,000 for some veterans. It's still available through the end of the year. So, if you know, that wants to buy a home, we'd look at $90,000. We've given out not to just vets, but to others over $1 million of this round of funding from the state. And we're going to be hopefully getting more by the end of the year, early next year. But right now, we still have some veterans funds. Thank you.
Thank you. All right, we're going to come back to Darcy Long.
Yep, Darcy Long, Chair of the Columbia Gateway Urban Renewal Agency and owner of Empower Financial.
And she sits on our board of directors for the Dalles Chamber. Got to throw that in there.
Yes, that's true.
We keep her busy, in other words. So Heidi Venture.
I was trying to keep it short.
Yeah, hi, I'm Heidi Venture. I'm co-owner of the only rurally located psilocybin service center in the state in Hood River, and I'm here because I support House Bill 2387 to improve the psilocybin services at the state level.
Thank you. I'm looking across my screen really quick. I'm going to introduce Heather Land. Her microphone is giving her the wonderful tech grief that some of our tech does. She is actually the communication specialist with Wasco Electric Co-op, and she is here to hear what she can. And we will, when your mics doesn't work, guys, just put your questions into the chat, and I will make sure that those get asked of our speaker. I also, Jennifer, do you want to say good morning? Oops, you're muted.
I was going to say I should unmute myself first. That always helps. Good morning, everybody. Jennifer Zimmerly of Ventus Health Columbia Gorge, and gorgeous morning. And yeah, operations as usual at the hospital. And as Lisa knows, full cherry fest push for what we've got going on. Although we did just have a great staff event yesterday that we did, encouraging our team to take care of their own health with mammogram screenings. We do same day mammogram screenings for our staff. Literally, they come down, we register them, we walk them right upstairs and get that taken care of them. And we had 66 employees come through and get that done yesterday. So it's always important to remind our staff to take care of themselves so we can take care of the community.
Awesome. Nicholas Ruiz, go ahead. I'm going to let you introduce yourself, and then I have one other person, then we'll bring on our guest.
Nicholas Ruiz Anderson here, Chief of Staff for State Representative Jeff Helfrich. Happy to be the fly on the wall and taking the good notes.
All right, thank you. And Trey Hendricks.
Hi, sorry about that. Yeah, Trey
Nope.
Hendricks. I am a government affairs consultant and attorney with Pinnacle Affairs.
Okay. Well, welcome. Thank you for being here.
Thanks.
With that, I'm going to bring on, I think I've got everybody. If I missed you, oh, Corliss. We do have one more person, Corliss Marsh.
Good morning, everyone. Sorry, I'm not on screen. I had eye surgery yesterday, so you don't want to see a pirate. Okay. So I'm with Habitat for Humanity, the Senior Center, and the library, and the College Foundation. I'm really interested about the library because we just got cut. Courier system is going to be no longer if we don't get our funding. And that courier system works with all rural libraries. And it transports, we had last year 90,000 transactions using the courier system. So we're really scrambling to get some money for that. Thank you.
Thank you, Corliss. You take care of yourself. All right, with that, I'm going to bring on our guest, Representative Jeff Helfrich. And one, I want to say thank you because I know it's crazy. Your job is always crazy. You're doing everything, but I wanted to say thank you for being here. We appreciate you taking time out again to help keep us in the loop and do that. And just one second. Phil, did I miss somebody? Is there a Phil on here? Oh, are you by phone? He must be. Oh, never mind. Someone's saying notes to other people. Got it. Never mind. I see the chat. And it's like, okay, wait a minute. What am I supposed to do? So anyway, thank you so much, Jeff, for being here. And I'm going to let you take over. If you guys have questions, go ahead and put them in the chat. Raise your hand. We want to make sure this is why we do this. So we can have this amazing one-on-one right here. And one, it's easy for them. They don't have to travel, drive, or that. They can just hop onto Zoom. And then we can go forward and actually stay in communication with each other. So with that, thank you so much. But Jeff, the floor is all yours.
Hey, thank you, Lisa. Thanks for everybody making time early morning in the day. I usually am at the gym working out, but I've been a little under the weather with the Capitol crud being sick. So I've kind of had to mellow out a little bit. So with that said, the one thing I'd say that came out of the pandemic has been the ability to have these type of conversations online. And that makes a big difference because it's a solid 2.5 hour drive for me from Hood River to Salem. And that's being generous if there's not a lot of traffic. And then out to the Dalles is another, 20 to 30 minutes on top of that. So it's a haul to get here to Salem. So that's why I stay down here during the week. But that said, we had the first chamber deadline was yesterday. And that means is there's any bills that didn't make it out of committee to get referred to the floor, or get referred to Ways and Means or Rules, are dead. So there's a lot of bills that died. I don't have that complete list, nor do I think I could have the brain space to even talk about what each bill meant and what was going on with it. So there's that. So there's bills, or there's committees that don't have deadlines, and that's the Joint Ways and Means Committee. The when I say Joint Ways and Means, whether it's the Money Committee or some of any of the joint committees like Transportation, Healthcare. There's a lot of committees that are the joint ones where the bills will still live. And then you have the Revenue and Finance on side, the House and the side Senate, where they need to be able to have the ability to write bills as needed up until signing day, which is the end of session. And then Conduct Committee is another one that has no chamber deadlines in case something happens with conduct wise. So I think the biggest thing is there's 30 bills that get put to, I think it's rules. Yeah. From policy committees. So anything that gets sent to the Rules Committee in the House will last till signing day, and that can be posted within an hour and then get a work session and move to the floor. So those are the two ones that are really sitting out there. One that's a really big one is the Farm Worker Standards Board bill, which has caused a lot of consternation. And I don't think it's a good bill. And you have agencies that protect workers' rights to begin with. And it's just another layer of burdensome bureaucracy that lands on our agricultural communities that are, Hood River and the Dalles are big ones because you have the cherry growers out there and the fruit growers. And those are things that are going to be tough on them with this. And so that's the one that's been kind of the contentious one right now. When it comes to like when bills move and move out, when I was leader of the House, you had when you're kind of behind the scenes negotiating what bill's going to move forward, what bill's not going to move forward. So you kind of have to know where all the members are at and what's going to be best for not just the state, but for their districts, because the members they're representing a group of people up to 60,000, each representative does. And so we're trying to make sure everybody gets what they need for their district, but also that bigger picture when it comes to what the state needs. So that's just kind of those things that go on behind the scenes that you may not know that goes on. But right now the fights are happening in those subcommittees and those committees of what bills are coming in and what coming out. So for me, the subcommittee that I'm on that has a lot of public safety into it, it's the Joint Committee on Ways and Means and Public Safety. Their budget, what we cover on their budgets are State Police, Office of Fire Marshal, State Supreme Court, Department of Justice, and a lot of those they're there. So you've heard about the crisis when it comes to public defenders, and you will hear that there's not enough defense attorneys that are prosecuting these cases. And then if somebody gets arrested and the case gets dropped within 7 days, if they don't have representation, I think is what it is. I'm suspect on that because there's a lot of money that's going out there. They had money before the pandemic. They got extra money during the pandemic. And now they say you need more money to keep going. And they've never really opened up their books because it's what they do. They have the consortium, and then they have other law firms that the state basically contracts with to bring in public defenders. And some states, what they will do is you have the district attorneys that are funded by the counties, and then you have the public defenders that are funded by the state or by the county, and they sit in the same courthouse, different ends of the building, and they are county employees instead of having these adjunct employees that are working for these law firms. And who knows what type of attorney you get to prosecute these cases. They have to fit in these different boxes, if you will, depending on the type of crime. And they just want more and more money. And now the Oregon Public Defense Commission or Committee, they actually published their 6-year plan back in March of 15. And in that, I was kind of looking through that, and they want to go back to taking crimes and decriminalizing them. And what I mean by that is we saw the debacle of 110. It was well intended to get resources to people that are affected by drugs and alcohol, mostly drugs, and get them treatment. Well, that fell short. And then what happened is you had the possession charge that was usually a misdemeanor, and then it got to a violation, and then nobody ever showed up, nobody ever got tickets because the governmental interest in that. And what I mean by the governmental interest is police officer puts hands on somebody and wants to seize those drugs or seize that person and get them either into treatment or help fight ensues, something like that. That person gets hurt, and then there's liability issues and all kinds of things that happen with that. And so people weren't getting the citations, weren't getting help, and we're able to recriminalize the possession of drugs, which gave law enforcement a tool to get people the either treatment first or into, if they're what we call a frequent flyer, get them into the system and then get them sobered up that way. So the commission has decided that they would like to see public nuisance type crimes removed from misdemeanor crimes to violations, which is basically a parking ticket. So trespass, harassment, some series of thefts. Those are three of the big ones that really come out in my mind that are just, you can't have that. We're a country, a rule of law, and if people don't have any laws to adhere to, and there's no punishment, there's no consequence for their actions, you're going to kind of see what happened with 110 with a lot of other stuff. And so when I say the harassment, the trespass, and those type of crimes, that's what businesses, when somebody comes in and starts yelling, ranting, and raving in a business, and even some criminal mischief, if those were violations, you would see just people come in and it's causing kind of chaos. And it starts in Portland, then it kind of migrates everywhere else around the state, unfortunately. So those are big ones. And then the other one that I saw there that really caught my eye was Measure 11, which was mandatory minimum sentences, because there's a gentleman that I work with, the good Representative Kevin Mannix, that is probably been around the building the longest time, but just an incredibly intelligent person. And he crafted Measure 11, and that crafting showed that if you commit rape, sodomy, all these horrible person crimes, you have to have a minimum sentence. And you have your manslaughter 1, manslaughter 2, rape 1, rape 2, all these horrendous crimes. And there was judges that were just giving time for people served, time served, and just different things that are happening. So he put it to the vote of the people, and people said, yes, we want it. Well, this commission in this report wanted to remove a lot of those crimes from having any type of that type of consequence where there's mandatory minimums. And the people have spoken loud and clear, not only with the kicker, but with that's what they want to have those. And you've got the bureaucracy on the other end, the state-run bureaucrats, I'll call it, that we know better and we don't have to really listen to what the legislature wants, the people want. They don't really know what's going behind the scenes. And that's just not how things go. So all that said, that presents a big challenge for businesses and everybody living on the streets. I'm on the housing committee, housing and homelessness, and it was House Bill 3054, the manufactured home rent control bill. It passed Ways and Means. We still haven't done a study of what rent control does and how that affects people. And a lot of people invest in real estate. Mom and pops invest in real estate, have 1 or 2 rentals, and that's their livelihood when it comes to their retirements. My father-in-law, George, has a rental there in Pomona Park, and that helps his income, and that's what he's based his retirement on, is that income there. And if your costs exceed what your rent, you can have your rent, that's a problem. If the city's charges go up, your property taxes go up, and if you're hemmed into a 1% or 2% or even 6% increase and your costs go up to 10 and 12%, that's a bad thing. And so everybody seems to think that landlords are evil, and that's not the case. They're just trying to, one, they've invested to make money, but 2, their hard costs continue to go up, and they can't pass that on to the end consumer. And so this is another way the study hasn't been done. That needs to be done to show, is this working or isn't it working? And how do we fine tune that? And could push a lot of the private owners out, and it's going to go to corporate. And if you don't have private owners that are, having some of these small properties, that's going to be a problem, because it's just going to be corporate kind of moves in, and it's going to be their way or the highway. And, you won't have that same type of being able to call up the landlord, hey, my water heater's not working. And they come down and get it fixed the next couple of days, where it could be big corporate. Well, put your request in. We'll see if we can get somebody out there as soon as we can. It kind of maybe gets lost in the noise out there. So that's that one. There's a lot of other stuff that's going on in housing. We understand there's bad actors, but there's a lot of good actors. And I think the good actors outweigh the bad actors. So go take care of the bad actors. Go hold them accountable, not everybody else. You don't need to make a law to hold everybody accountable when they're 3/4 of the people are doing what they're supposed to be doing, and there's a quarter that's not. Go after and target the people that aren't playing by the rules and doing the right thing, and enforce those on them. So that's what we have. The biggest one coming out of housing. Transportation. It's good to be back on the committee. I've said this from day one. My job is to make sure I can get that Hood River Bridge funded, and I don't know if that's going to happen or not. I'm trying it. There's not a lot of money left once the bills are paid because of what's going on at the federal level. And I have no clarity, no vision, no insight to any of those things. When I hear people talking about they've lost their funding for the schools or for whatever programs are out there, the library program that was mentioned, I just don't know what that's going to look like. And I have no idea where that lands. I would say give it 30 days. You'll kind of see the way the dust settles. Just kind of wait and see. The committee, the framework that came out was there's a $1.8 billion deficit, and there is the highway trust fund that has a 50, I think it's 50, 30, 20 split for cities and counties get the difference, that extra 50, and the state gets the other part of that for the gasoline tax, and that goes out of there. That's slowly drying up because we've pushed and gotten better vehicles that have better economy, better fuel mileage. We have electric vehicles. There's a lot of things that are going to be there. That framework that they released, that's a starting point. I think that's the high water mark. And so we will see what negotiations look like on that. I don't know who will be on that negotiating team or what that looks like. But to be a fly on the wall and listen to that would be very interesting to be a part of that conversation. So we'll see how all that shakes out. But they're talking about registration fees going up, title fees going up, weight mile tax for the larger rigs that are out there. And it causes that weight mile tax when you have outside trucking agencies come in and have to pay a different type of tax structure than anywhere else in the states, anywhere else in the other parts of the state, in the country, that causes a problem. That just causes more headaches for them. So the more we can standardize stuff, around the country when it comes to these taxes, I think would be better. And I think that's it on that one. What else I got? I think that's kind of where I'm at. We've talked about taxes a lot. And if I'm going to ask for more of your money, I want to make sure it's getting spent right. And before we give ODOT any more money, I need to see systemic changes within that organization, because they had a $1.2 billion accounting error is what they'll call it, where they had said all this money was coming in, so getting all these projects ready to get funded and go out the door. And the way the feds send the money out, or the way the states send the money out, it's not, you don't just get that big clump of money in your ODOT bank account. It comes out in segments. And a lot of those projects didn't get funded later on because the funding didn't get directed towards them like they needed to. And it caused a lot of headaches. And with the DMV issue, when it came to voter registration, there's not a lot of trust in that organization right now. And there's a lot of bureaucracy. There's a lot of layers of administration that's there that doesn't need to be there, and how much money is getting spent. I drive around Salem and I see ODOT building here, ODOT building there, and there's a lot of ODOT buildings. And I'm just trying to figure out how many buildings do they actually need to get their job done and what that looks like. So Lisa, with that, I'll take questions. I don't know if I'll have all the answers, but if it's anything federal related fundings, I do not have a clear vision or sight picture into that. So I don't know. Just straight up with that.
Thank you. I don't know that anybody has answers right now. We just have to watch and wait, and then also speak up. So is there some questions? This is your time that you guys get to ask. Yes, Dan Spots.
I'll jump in on that last one, because I know none of us know what's going on, but I'm wondering, are there any communications going on between the Oregon legislature and our congressional counterparts to try to find out, or are we just kind of waiting for whatever happens next year? Is there any discussion of the impact of what's going on in DC at the rural level in Oregon, our urban as well, but I'm of course more focused on our rural communities, to try to discuss the impact that this is having? Are there any formal communications or informal communications or discussions or anything, or are we just kind of hanging back and what happens?
No, Dan, like Senator, my roommate's Senator Mike McLean, and he knows Cliff, Congressman Bentz really well. Those conversations are happening with staff. They're happening with that for our congressional in our part of the district, which is kind of weird because it stops in Hood River. But Congresswoman Maxine Dexter is our representative for the U.S. representatives, and so she gave me a call yesterday, and I haven't had a chance to call her back. But was wondering about the budgets and kind of going over what that is. But I do know when she came to Hood River and kind of stirred the pot a little bit in the sense that the bridge is dead, it's not going to get funded. And no, that's not what I'm hearing. And so before we start making these statements, let's hear exactly what's going on. And just, I think sometimes this is we see more partisan politics in the DC than you see at the local level. And when I hear people saying, oh, this is going to happen, the sky is falling, it's just kind of wait and see where stuff's at. I know, but I can say that I know, like, leadership here is talking with leadership, the congressional delegations where they can, where those inroads meet. But we have one, as a Republican, we have one congressman, and that's Cliff Bentz, sitting there and having those communications. And, like I said, Maxine reached out to me and reached out to some others about some stuff. And so the conversations are happening, but I think you just got to kind of wait and see where they're starting to go through all these different agencies, where the money's at and how much money's there, and it's got misappropriated or not spent right or whatever. So it's just the wait and see game. I mean, I know it spooked our Ways and Means Committee here. They have really tightened the budget down, where there's not going to be a lot of projects going to get funded, depending on what the feds do. I mean, we're looking at agency cuts. We've gone through exercises 5 and 10%, what that looks like for all agencies, and it's a haircut. It's not a full slash and burn, but it's a haircut, and everybody's going to have to live within their means right
now. This is Brian, kind of following on that with the tariffs. Are people starting to kind of look at what it might do to the economy here and also to your budget? Because obviously, if we're not exporting to China and other countries, what will that do to your budget here as far as funding? So if we don't have the revenue coming in,
right? That the tariffs is like 2 or 3 levels ahead above me, but those are conversations they're having. That's the Reschkes of the world, the Nathans of the world that are on the revenue side of that. They understand that more. I'm more on the policy side of that, but those are good points to make. But also, how much are they charging us to let stuff go out of their country and into our country? And I know the cherry growers have the largest producers of cherries leaving, exporting. And so what does that look like and where are they going? So yeah,
cherries. I know when I was working at the research station, I mean, a lot of the product goes to China, and at a very high price. And so I guess I'm just concerned what this could mean to some of our producers and the organizations here if they can't export to China and some of these other countries because of tariffs. This is going to be kind of a tough road to hoe here. So,
well, here's what I would say when I was listening to a program coming into work today was, they said 50 plus countries have now come to the federal level to negotiate tariffs. You've got China back and forth. That's just one country. There's a bunch of other people out there that are willing to work with the United States. And so, again, that is the federal level. And I don't have that clear vision. I can give you thoughts and things like that. And I understand where you're coming at, Brian. But at the end of the day, I don't know. I just don't know where that lands at.
And Phil, do you have a question? Yes, go ahead.
Thank you, Representative. One of the bills I'm working on, coordination with Association of Oregon Counties, is House Bill 2056. It's based on last year. It was House Bill 4092 funded a study to see how our mental health, behavioral health services, are they getting enough funding, and found that there is a gap. And so the House Bill 2056 is to take that study and say, okay, we figured out there is a gap in funding and close that gap. Here in Wasco County in the Gorge, the two things we're putting together. Behavioral health, bringing people off the streets, doesn't work if we're still living on the streets. And so housing is important, to have a place for people to stay while they're, getting themselves back together. So we're working on getting both of those ends together, both the housing, temporary housing, so they can have a place to stay where they're getting the treatment they need. So, get back or move into this also deals, of course, with aid and assist issues. So we're asking her to support 2056-1.
Yeah, Commissioner, I was a big proponent when we recriminalized drugs, Measure 110 reforms that we did in that House bill. So I know I was able to get $20 million for the treatment out there in the Dalles. I know there's more money that's needed, so I worked on that. There is the housing, we've spent a lot of money when it comes to housing first, but we got to get the treatment. So there's hand in hand, and supporting the annex that was out there. That's a big one. I know doing that, it caused some consternations within the community. And the annex has done a tremendous job of making sure any of those issues that were thought were going to happen didn't happen. So not lost on me, but I'm trying to pull up 2056 and see where that's at in committee, but I can't get my computer to.
What you're looking for there, you're right about the annex changing people's minds. That it's one of the directions where people have gained trust in the entities like behavioral health, because they saw, wow, this really did work well. Also, that's why you're also looking for that. With our housing authority is putting together, bringing a new position for director of housing developments. So that's going to have a key person who's really focused on getting out and doing the development work, whereas it used to be our director was split that role.
So that 2056 is out of committee. It's got a -1 amendment on it. It passed unanimously out of the committee, and it's going to sit on the speaker's desk, but so it did pass. And so there is that. So here's the thing about treatment facilities and housing and stuff that we're talking about. The certificate of need is a ability to have private companies come in from out of state or wherever and create these places for resources, i.e. mental health treatment, drug treatment, but you have to demonstrate to the state that there is a need for it and to bring in outside people and stuff. And in watching that, not ever hearing about what that meant, that certificate of need meant, and watching where it's at now, I'm super frustrated that you have to ask the state to say, hey, to prove there's a need, and then all the other people that would be competing for that same position or that same facility, you got to say, oh, we don't need to have that. We already have these here. We've built up too much. And so what they've done is taken the free market economy and hemmed it in a little bit. And I was really surprised about that. And so you have providers from other states that could come in and do that and do it cheaper, but it's all revolves around Medicaid and Medicare dollars. And because if you have a private person coming in, they're not having to take Medicaid and Medicare in there, and it's just treatment coming in and dollars used. A lot of agencies don't like that because they would lose some funding because of it. And so I'm kind of watching the shell game play out, and it's kind of super frustrating when you have people that need treatment and let's get it fixed, but yet the behind the scenes, the red tape that's caused from it's kind of frustrating on our part. And I just talked to Representative Ed Deal because he was NOST was the chief sponsor, and Ed Deal was one of the sponsors on that House Bill 2056. And Ed Deal has been really big about the certificate of need. So there's a lot of stuff that interplays that you don't realize until you kind of see behind the curtain what's going on. It's like super frustrating sometimes. Lisa, who else you got?
I'm looking. I'm making sure there's no questions up here, and I don't see any. This is your guys' opportunity. Is there any questions? There's no too small or too big. If we don't know the answer, we'll get you connected.
23. Somebody mentioned 2387, I think, a little bit ago, the psilocybin. I'm going to get that wrong, I think.
Heidi, was there anything that you had any questions on?
Thanks for asking. Do I have any questions about it? I wish it had all the things I'm concerned about in it. I think if you could see what's happening in psilocybin service centers and the mental health results that we're getting with people who are suffering with depression, post-traumatic stress disorder, anxiety, end-of-life anxiety, it's really amazing. And, to Phil's concern too, addiction. We're seeing people who didn't even want to quit drinking. And yeah, so the bill is basically just fixing a few things around professionals not being able to not being able to be facilitators safely within the bounds of their medical license or their
The scope of practice, yeah.
The scope of practice. But it also
It did pass. I'm sorry, it did pass out of committee. Full, all were eyes on it. It's not scheduled for. I'm trying to find out its fiscal impact. So when stuff gets a fiscal impact on it, that's where it gets sent down to Ways and Means. When it's sent to Ways and Means, that means, is there going to be money to fund this project or not? If it's a few $100,000, it probably does. But if it's tens of millions of dollars, then there's more scrutiny looked at it. But it says a minimal fiscal impact, which means it doesn't work. Doesn't look like it has that. So, yeah. So it's maybe sitting down Ways and Means. It didn't say where it got referred to. So I understand that we heard a lot about that in our caucus meeting. Veterans, as I'm one of them, but one of the veterans is Alex Scarlatos, who is a champion for veterans and working on that. That's one of the treatments they're looking at for veterans too, for their PTSD. So it's supported. Yeah. I just don't know where it's going to land at.
Yeah. Okay. Yeah, that's all. Otherwise, I don't have any questions for you. Thanks.
Okay.
Any other questions?
Yeah, I do have one. Jeff, how in the world do you
balance?
balance?
You were always asking. You always got that question. You always got a question.
It's a nice question. Okay. How do you balance everything and stay sane in this crazy times? And also, I do have one beyond that. Everybody on the meeting probably knows about it already, but the legislative tracking system. Would you like to talk about that? If we want to know what Olis, if we want to know how that works, and I could throw a link in and.
Yeah. So to answer your first part of the question, I usually hit the gym every day, go over there, get my headset on or get my ears on and go walk. There's a YMCA. It's just literally across the street. And so I park here at the building, go there, work out, get dressed there and come over here. And so that's my daily routine, figure out what podcast I want to listen to, whatever music, get my headspace right, and then get over here. But there is the OLIS system and it's the Oregon legislature. Dan will send a link out. But it's pretty easy to navigate. You'll see the different representatives that are in the system, and then you can navigate over committees, and then you'll see a little icon that says bills. Then you just type in the bill number that you have. You have to make sure you're on the 25 session because it archives back to like 20, I think is what it goes 5 years back on the system. So you got to make sure you're in the right year. And then you can just sit there and look and see where the bills are at, and it'll show measure history and where they're headed to. And so it's a good resource if it's just another tool to see what's going on in the legislature. That was a softball question, Dan. I like that one, so we're good.
I thought so, I asked you to solve the federal budget issue already, so I figured I better follow up with a.
Give me one that says, hey, I got an answer for that one. There you go. So yeah. All right.
There we go.
My chief of staff just put that in there, so that'll show you the Oregon legislature's stuff. So.
Scott.
So yeah, since we have some time, I mentioned last time you spoke about House Bill 3497 to create a task force for a multi-sector plan on aging so that all the different departments will look at the services they provide and take into account how it affects older adults. It passed got out of committee, and they identified a fiscal impact of $80,000 and it's going to Ways and Means. Just from the inside scoop, is that a significant barrier, do you think, at these very tight times? Or
$85,000 is not a significant barrier.
Okay.
If it's $105 million like a Hood River Bridge, there's a lot to overcome with that. So I mean, that's kind of the things. But just know that they're, 2 nickels rubbed together gives you 10 cents. And so if you get a lot of nickels together, that can add up. And so we got a big hole in ODOT. No promises, but I'm just seeing who's on that bill, and I don't see it having a problem, but because it's got good support both sides of the House, so yeah, in the Senate. So the other thing you mentioned this, and I saw an article or watched something. I think it was I can't remember. It was over in Europe, and they had it was a dementia care center and a memory care center, and what they did. It was like a town. It's like a town that they lived in. You had a grocery store. You had all these things like normal life would be, but it was enclosed in this area, and the patients couldn't get out. But the workers there were the people that you would see on the street and stuff like that, are working in a grocery store, department store, whatever it was, and people could kind of go putter around like their normal lives were. They would remember certain moments and they wouldn't. And I just thought, with my dad, the way when he passed away and where his dementia was at, I said just sitting in a nursing home or rest home and just kind of slowly fading away. I thought, I don't know, how do I get behind that kind of project? Because to me, that we've got a lot of our aging adults that are getting into that dementia stage or Alzheimer's, and just kind of let them live life like they would normally, that they would kind of know and move through it. And so I saw that, and that really made me think, like, how can we do that here? I know it's a lot of money and get something set up like that, but that if I got dementia, I could kind of putter around, think I was like back to normal life and knew I wasn't going to get hurt and stuff. That might be the way to go.
Yeah, and it all depends on what level of dementia they're at. I mean, we have a lot of folks who with dementia, early stage and so forth, are living independently. And one of my favorite quotes is that dignity does not take away dementia does not take away the dignity of an individual. It's how we treat the person living with dementia that takes away the dignity. And like that village you're talking about, that still respects the dignity of those living with dementia. So that's really good. So, one last thing is that with Age Plus, we talk about ageism a lot. And one of the things that I know Dan's working on childcare, and a lot of times we talk about childcare, where in reality it could be caregiving is the better name for it, because there's a lot of folks who are middle-aged who are caring for their parents. So a lot of times it's not just caring for children, it's also caring for older adults who may be living with dementia or some kind of chronic illness. So I just had to throw that out real quick, little plug. And so thanks again, Jeff, for attending.
Oh yeah, absolutely. I'm getting close to my time for Ways and Means. Phil, I think you got your hand up, and I got to get scooting out of here, getting ready for my Ways and Means committee here.
Thank you. I really appreciate taking time, because we were out here way on the edge of your district. Actually, we kind of get two representatives here in the Dalles from east and west. The news coming out of Washington State of their budget crunch affecting funding for the scenic area, Columbia Gorge scenic area, kind of gives us a shock. Like, oh my gosh, we think of that as such a stable rock like Beacon Rock, but it actually has some fragile underpinnings. Just to invite your thoughts on it. My own thoughts are, over the last 50 years, the work of the scenic area has really, we've internalized that now as communities. No, you're not going to touch the gorge, and we've also put it into our land policies and our land use here at the county level, which is where all the permitting happens anyway. So what has happened? What's the talk in Salem and Hood River area regarding what's going on in the Gorge Commission?
That took me by surprise that Washington did that. We had the budget ready to go. The Gorge Commission had came in and talked to me about their budget, and I was like, well, it'd be nice to add those bodies there that you want, but you're probably have to run with what you have right now. And that was prior to Washington saying they weren't going to fund it. So we don't have the ability to pick up the funding because the way it's split out in the National Scenic Area and who pays for what. So I think that's a game of who blinks first is what it boils down to. But I have, since Washington did that, I was trying to get a hold of my counterpart in Washington and see what their thoughts were, and we haven't been able to connect yet.
Jeff, a follow-up on that one. If that cut goes through in Olympia, does that trigger an automatic cut in Salem, or does Salem continue its funding?
I don't know what the compact, the rules say in that, but I can get back to you on that and see what that compact is.
Okay, I'll track it. Jeff. Thank you.
All right. I got to jump, guys, but thank you for being here. Thanks for letting me be a part of your morning and go from there. I know it was just a couple weeks ago I was here again, but look forward to the next one, and maybe in person would be nice.
Okay, well, we'll see what we can do, but thank you so much. I appreciate you being here, and I'm going to let all of you guys go. You get a few extra minutes, so take care, and we will talk soon. Don't forget about Cherry Festival. It's around the corner.